good morning. I'm Dr. Rohan Krishnan, and you're watching Medical Dialogues Presents the Health Perspective. India has largest number of doctors around the world, with more than 1 million doctors, and every year more than 80,000 medical students getting graduating as MBBS doctors, if around 529 medical colleges in the country. One of the most elite branches in the field of medicine, orthopedics, has risen and fallen with period of time. Now, what is the trend today about for orthopedician? What are the norms for today's orthopedician and how it was earlier? To discuss all this, I am pleased to welcome one of the most pioneers of orthopedics, Dr. Sudhir Kapoor, sir, who is my guru as well, and he has been in the field for more than 38 years of continuous experience of working in major public hospitals in Delhi, where daily outpatient attendance is more than 250 to 300 per day. He has been worked as the professor and head of department of orthopedics of Maulana Azad Medical College and Lok Nayak Hospital. He has worked as dean and professor and head of orthopedics and postgraduate institute of medical sciences and ESIC Model Hospital, New Delhi, and has worked as director professor in the Indian Spinal Injury Center. And he is also worked as the president of the Indian Orthopedics Association. A very warm welcome to you, sir. Thank you so much for giving us time, sir, from your busy schedule. We all are very thankful, sir.
Thank you, Dr. Rohan, for a wonderful introduction. I do not know whether I deserve it or not, but thanks a lot for very generous comments. Thank you, dear.
Sir,
Whatever
sir,
you want to ask me, please do ask. No problem.
yes, sir. Sir, we are talking about orthopedics as a branch, sir. Sir,
Correct.
you have been in the field from more than 38 years. How have you seen it? Has it evolved? This program is mainly for the young doctors who will be choosing the field, who has just passed out and now for the NEET counseling. What do you suggest to them that over the 38 years of your experience, has the field gone up or it has gone down in general?
Okay. I recall my days when I started in 1981, when I passed my MS. I joined my MS in 79. From that year onward, I have seen a tremendous change in orthopedics. This change has been to large extent technology driven, and the efforts of the people who have joined this branch to excel and be at par with the best in the world. Nobody could think of knee replacement in 1981. Now we are making the patient walk the very next day after knee replacement. I'm also myself doing it. That way, technologically, we have progressed much in orthopedics. Fracture fixation has become very good, the main thing. And actually, every branch. What I have seen over the years is that gradually, the people who were general orthopedic surgeons who used to handle everything, now people are super specializing in branches of orthopedics like arthroscopy, arthroplasty, foot and ankle surgery, pediatric surgery, and so on and so forth. For times to come, I understand that gradually every orthopedic surgeon, if he chooses to practice in a reasonable town or a city, would have to have some excellence in a particular specialization of orthopedics. There's one change I have seen over the years. Maybe people who intend to practice in smaller places or in rural area, they have to be general orthopedic surgeons, but they would also to know when to refer a patient of orthopedics to a specialist in orthopedics in particular branch. There's a change I have seen. Basically, technological advances and the efforts to or the requirement to excel in any super specialty of orthopedics. There's one change, big change I have seen.
Sir, as you are rightly saying that nowadays people have to do some kind of super specialization in the field of orthopedics.
Right.
Sir, is there any course which is mandatory, which is recognized by the National Medical Commission, or because many of people after doing orthopedics they get confused like where to go because every hospital now are offering fellowships. every hospital in India, any big, even not so big, any decent hospital is now also offering some kind of fellowship course, which many of the students complain that it is much of a use and extract the labor from the students rather than teaching them or actually giving them opportunity in that field.
Uh, I will not agree to this general conception in toto. First thing first, first you wanted me to tell you what are the further super specialization recognized degrees or recognized courses. Well, there are few courses which have been recognized as a post MS courses by national board. They are mostly in spine surgery, they are or in foot and ankle surgery, or in hand surgery. Now, other many centers are offering specialization after MS, but few centers are excellent. They are doing wonderfully good job. My own postgraduates have done from them, and their training is very good. For an example, I would like to mention Ganga Hospital. Ganga Hospital spine surgery as well as hand surgery is excellent. They are trained very well. Similarly, in Delhi, in Indian Spine Injury Center, spine training is good. In Chennai, there are one or two centers which are offering FNB, and I had the occasion to inspect those centers. They are also offering good courses. So we cannot say that every center, whichever is offering some specialized courses, exploiting the students. Yes, there are centers, but at the same times, there are good centers. I mean, pediatric surgery in Mumbai. There are so good centers which are really offering very good training to the people who are joining there. In that context, I'll like to mention Tata Memorial also for ortho-oncology. These are 3 or 4 courses. I mentioned spine surgery, hand surgery, pediatric surgery in Mumbai, then ortho-oncology in Tata Memorial. It is difficult to get into it, but once you get into it, you come out as a very good trained person. So I mean, at the same time, I do agree with you, or few people perception that at few centers they are very less. Fortunately, there are few centers. They are basically the candidate is not being offered much training. Rather, it is more of a work. They are doing that. I agree with that. But at the same time, the candidate has a choice to appear to first to choose the postgraduate specialization, and then make efforts to get to the particular center. I mentioned few centers already, and they are excellent. There's no doubt about that.
Sir, one more question that our viewers always ask us. Sir, just after passing MS, you have worked in government as well as private sector, which are offering better salary packages for the student if you want to go to job, and what any advice you want to give to the student who wants to go to private practice in urban cities?
Dr. Rohan, one thing is very clear. Whatever specialization you wish to do, you have to be trained very good in orthopedic trauma. Once you learn the basic principles of managing orthopedic trauma, then whichever field you choose to excel in or to specialize in, things become easier to pick up. No orthopedic surgeon in India can survive without a good training in orthopedic trauma. So my first advice will be that before you choose a particular specialty, please spend some time at a center which has good trauma services, where inflow of the patients in the emergency is good, and you are given a chance to operate those fracture cases or the common cases. Once you have acquired a reasonable proficiency in trauma, maybe after a year and a half of working in a big hospital, then I think you should go for a specialization. It is I think will be it will not be useful if you immediately after passing out you look to join a super specialist area. That will not be a intelligent thing to do in your life. Even if you specialize in a particular specialty, trauma will you will always be called to handle a trauma. So my suggestion is that for initial some time, 1.5 year, spend at a good center which is offering a lot of trauma care and giving chances on doing surgeries in emergency at least. Then you decide or choose by that time what specialization you want to choose, and then you go in for the specialization. This is my advice. As far as the salary package is concerned, I will little differ, or I like to express my personal opinion. Rohan, please understand, the immediately 1 or 2 years after MS orthopedics is your basic foundation of your future orthopedic career. Salary or remuneration at that stage should not be a consideration. This is my feeling. If you get enough money to survive decently, then it is worth it. Even if you are getting less money than centers who are offering more money but giving you less opportunity to work on trauma cases. So initial 1.5 years, do not think of money. Just have enough. Just join any center which gives you reasonable emoluments to survive yourself, and but at the same time offering very good trauma services. This is my personal opinion. A few people may not agree, but definitely I do feel at the same time, I do feel that people who have done their post graduation should be given a justifiable emoluments. It should not be peanuts. After he has done his MBBS, he has done his MS. It should be a decent money. But for a trainee, for a person who has just passed MS, I would again stress that do not money should not be the only criteria of joining a center for initial 1.5 year. Once you have burdened the center, put in your best efforts in those 1 or 2 years. It may be 24-hour, 4-hour duty, it may be 12-hour duty. Do not worry about the duty hours, because that is the your foundation for future, for whole of your life. So initial 1 or 2 years after passing MS is very crucial. This is my opinion. After that, you decide. By that time, once you have done your 1.5 years or so of trauma care in a good hospital, by that time you are able to choose and decide that which specialty suits me best. There are several factors which will decide about the specialty. First thing is the interest. Second thing, a very important factor, which is mostly people do overlook, in which area are you going to settle down ultimately? That is very crucial as far as I think. This is my take on these two questions.
Very true, sir. Even I completely believe, being in the field of orthopedics, that the number of surgeries you do in emergency independently is one of the most important factor of learning orthopedics. Because when you are responsible yourself, you think more. You have to understand the patient properly. You read and then you go. So everything works up like that. Sir, one of the other important issue that I would like to cover is the ethical issues, sir. Today we are seeing that there are a lot of medical legal cases when it comes to orthopedics. So, sir, what ethical challenges and how one should prevent ourselves from such challenges?
Ethical and
Medical legal.
medical legal, they are two different aspects, but they quite often they intermingle also. I think the hallmark of my, unfortunately this has happened. I had not seen in my initial years of my orthopedic practice, but things have changed over a period since the time the decision was taken that the patient is a customer and you are a provider of a service. Since that time, things have changed, and you any professional and any medical professional has to be very strong in his own to protect his own interest as far as the medical legal aspects are concerned. First and the most important thing is that you must maintain proper records. Records are one thing which will save you in any medical legal situation. Time and again, it has been stressed in every meeting, in every place. Once your records are straight, you have recorded everything which you told the patient, then chances of you getting into trouble are minimal. Of course, it goes without saying that we have to be truthful and to our patients, give our best to for their care, but please record everything. And once you to go into practice, always this has become a prerequisite now, unfortunately. Always have a good amount of insurance before you join it. Fortunately, premium is not very high. In 5,000 rupees, you can get a premium coverage of almost 50 lakhs. So please take that coverage. Be truthful to your patient. If you are stuck somewhere, if you are stuck somewhere, you think the patient is difficult, the patient has got some problem, do not hesitate to ask a colleague who knows better to handle that situation. Truthful to your patient, maintain records, take an insurance, and at no stage think that you know everything in orthopedics. At this stage of my life also, I have no hesitation in consulting even my junior if he has specialized in say foot and ankle surgery. If I come across a patient about which I am not very sure, I do take advice from my colleagues. There is no harm. But do not think that you once you have earned your degree, you know everything. Wherever you are stuck, talk to somebody who is more expert. So these are three or four advices which will really help anybody. I'll again repeat because they're important. Number one, be truthful to your patients, maintain records. Once you enter into private practice, take a good insurance. And wherever you are stuck, do not have a second thought in consulting a colleague or a senior who's more proficient in that particular branch.
True, sir. True, sir. You have briefly covered every aspect of the show which we wanted to cover, sir. Is there anything else that you want to give a message to orthopedicians across the country, sir?
Yes, I do want to give because this is one thing which is really troubling me for a long time. Fortunately or unfortunately, the system has become such that we all of know it is open secret about the lot of money being spent in private institution to get into MS orthopedics. Unfortunately, there are centers, there are private places who take money, but the training is not good. I have no intention to mention them, to mention their names. Whatever I'll advise the listeners who are intent to join any private institution. Even those private institutions you choose, try to choose who are a little better. Even if the institute doesn't have much of orthopedic training, whatever you try, whatever you can do to get the best out of the minimum you have got, please do try during those 3 years. Because of the NMC regulations, it has become mandatory for every institution to have a professor, a certain amount of faculty. A professor there who has joined there is always experienced here. Maybe your center has got few number of patients, but your professor or your senior faculty member has gained experience in his previous career. Try to make maximum use of that at least. And because if you lose those 3 years, then they will never come back. After you earn your MS degree, you will be very hesitant to ask a basic question to somebody. So try to make best use of that. Try to choose a private institution. If you intend to join a private institution, try to choose a private institution which offers comparatively better training. I do not want to name anyone because there will be not in good taste. But all of us know and have seen which are good and which are bad. And after that, even once you have joined, the number of patients or number of surgeries may not be as much as in a government institution. But whatever is available, try to make best use of that. Do not lose heart. In my past stint in a private institution, I know most my postgraduates who by their own efforts I have handled about 12 of them. 3 or 4 made excellent effort and they are now reasonably proficient orthopedic surgeons because of their own personal efforts to make best of a rather not optimal situation has really earned them good training. This is my advice. Otherwise, if you lose those period, then it'll be very difficult. Once you earn your degree, you'll be very hesitant and you will feel very hesitant to ask a basic problem from some senior. So make maximum use of that period. Do not lose heart. Even if your institute is not good, try to make try to learn something from your faculty, senior faculty member who has experience of handling large number of cases. This is my advice.
True, sir. I completely agree with you, sir. In those 3 years, we are always under supervision, and there is someone whom we can ask anything to our professors, to our seniors, and the maximum which we learn is during our postgraduate courses, especially the pre-op and the post-op management. We learn mostly in the PG years, which is also very very crucial in today's era, where a lot of medical legal cases are also happening. And as you rightly said, be honest to the patient, keep data recording very very strictly, adhere to it, and have a insurance for some time where you can land up in trouble. Thank you so much, sir, for giving us your time, sir. We are highly obliged to you. Thanks once again, sir.
Thank you, Sean. Thanks a lot.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.